Imagine waking up swinging your legs out of bed and your knees remind you they're still there, that dull stiffness, that hesitation before standing up, or that sharp twinge when you take your first few steps. If that sounds familiar, you're not alone. Over 60% of adults over 60 report some degree of knee pain. But what most people don't realize is that in most cases, the pain isn't caused by wear and tear. It's caused by weakness in the small, supporting muscles around the joint that stop doing their job. The good news? You can fix that safely and naturally. Today, we'll look at 3 proven movements backed by physical therapy research that can strengthen your knees, restore stability, and reduce pain, even if you've been struggling for years. No gym, no special equipment, just 3 exercises that reactivate what your knees have been missing. Let's start with what really causes knee pain after 60. It's not just cartilage loss or age, it's muscle imbalance. Over time, we sit more, move less, and rely on the same limited range of motion. That makes the quadriceps, hamstrings, and glutes weak, and forces the knee to carry loads it was never designed to handle alone. In clinical studies, people with chronic knee pain show up to 40% less strength in their thigh and hip muscles than pain-free adults. When those muscles stop absorbing shock, the knee takes every step as impact. So, if you want to stop knee pain, you have to strengthen the support system around the joint, not just the knee itself. Here's where to start. The first movement is the chair sit to stand, also known as the functional squat. This is the single most effective, low-impact way to restore knee power and confidence. Sit on the edge of a sturdy chair with your feet flat and slightly wider than hip width. Keep your back straight, chest lifted, and arms crossed loosely over your chest. Now, press your feet into the ground and slowly stand up. No hands, no momentum. Then lower yourself back down, under control. That's 1 rep. Start with 8 to 10 repetitions, rest 30 seconds, and repeat 3 sets. This movement strengthens your quadriceps, the key shock absorbers for your knees, while training balance and coordination. In a 2021 study at Osaka University, older adults who practiced chair sit-to-stands 3 times a week reduced knee pain scores by 47% and improved walking speed by 28% within 8 weeks. The key is control. Don't drop into the chair. Lower slowly. Your knees should stay aligned over your toes, never collapsing inward. If standing feels difficult, begin with a higher chair or place a firm cushion under you to shorten the range. As strength improves, use a lower seat. You'll be amazed how fast confidence returns once your legs remember this pattern. Now, once you can comfortably do 10 controlled sit-to-stands, it's time to add the second movement, the one most physical therapists consider the secret to long-term knee protection. It's called the step up. Find a low, stable platform, a stair step, or a thick book on the floor. Place 1 foot on top, shift your weight forward, and step up slowly until both feet meet at the top. Then step back down with control. Alternate legs every 5 to 10 repetitions. Start with 2 sets of 10 per leg, resting 30 seconds between sets. This movement strengthens the glutes and hamstrings, the big engines that take pressure off your knees. Research from Kyoto Medical Center found that step-up training reduced knee load by 30% during daily walking and increased overall leg strength by 25% after just 6 weeks. A tip: when you step up, think about pressing through your heel, not your toes. This activates your glutes, the muscles that stabilize your hips and prevent your knees from collapsing inward. If you feel unstable, hold onto a wall or chair for support. As your strength grows, the step height can increase gradually, but never to the point of pain. And remember, the goal isn't speed, it's precision. Every controlled step trains your brain and your body to move together again. Now, the third exercise might surprise you because it looks simple, yet it's incredibly powerful for joint stability. It's the straight leg raise. Lie flat on your back, 1 leg bent with the foot flat on the floor, the other leg straight. Tighten the thigh of your straight leg, flex your toes toward you, and slowly lift it until your knees are level. Hold for 3 seconds, then lower with control. Repeat 10 times, switch sides, and complete 3 sets. This exercise isolates and strengthens the quadriceps without compressing the knee joint. It's often used in rehabilitation programs after knee surgery because it safely rebuilds the muscles that protect the joint. In a 2020 study from Nagoya University Hospital, adults over 60 who performed straight leg raises 5 times per week for 12 weeks showed a 32% reduction in knee pain and significantly improved ability to climb stairs. If lying flat is uncomfortable, you can do this in bed or even seated with your leg extended. The key is to fully contract your thigh each time. Feel that muscle working before the lift even begins. After just 2 weeks, most people notice they can stand longer, walk farther, and bend without as much hesitation. After 6 weeks, pain levels drop significantly. What many people over 60 don't realize is that knee strength behaves differently with age. Muscle fibers shrink faster, especially in the quadriceps and glutes, and the nervous system becomes less efficient at activating them. This is why movements that once felt easy can suddenly feel unstable or effortful. The good news is that these changes are highly reversible. In clinical studies, even adults in their 70s regain significant strength within 6 to 8 weeks of consistent, low-impact training. When these muscles strengthen, knee pressure decreases, joint alignment improves, and everyday activities become smoother. Another important point is that joints respond to repetition, not intensity. Gentle daily practice stimulates blood flow, supports synovial fluid production, and improves the way the joint absorbs load. This is why frequent, controlled movement protects knees better than occasional hard workouts. It's consistency that restores function, not force. Together, these 3 movements, chair, sit to stand, step-ups, and straight leg raises, target all major support systems around the knee. They train strength, balance, and muscle coordination. They don't just mask pain, they fix the root cause. And here's why consistency matters. Your joints rely on something called synovial fluid, a natural lubricant that cushions and nourishes cartilage. This fluid is produced only through movement. When you exercise regularly, your knees literally bathe themselves in healing fluid. That's why even gentle daily activity has been shown to slow arthritis progression by up to 40%. To make these movements a habit, try this simple sequence every morning or evening. Start with 30 seconds of ankle circles to warm up. Then 10 slow sit-to-stands. Next, 10 step-ups per leg. Finish with 10 straight leg raises per side. The full routine takes less than 8 minutes, but the payoff is huge. More strength, better balance, less pain, and the quiet confidence that comes from moving freely again. Now, one final note. Pain is information, not punishment. If you ever feel sharp or sudden pain while exercising, stop, rest, and consult a professional. Mild soreness or warmth after movement is normal. It means your muscles are reactivating. Your knees are not doomed by age. They're waiting to be reminded how to work properly again. And the research is clear. Even at 70 or 80, the body still builds strength and resilience with the right kind of motion. So, if you're over 60 and tired of stiffness or hesitation with every step, start here. 3 simple exercises, no equipment, just your body, relearning what it was built to do. Because you don't need perfect knees to live without pain. You just need strong, supported ones. Start today. You'll feel the difference in a week. And in a few months, you might just forget you ever worried about your knees at all.
It's straightforward, and you'll be back to normal soon.